We are live this evening. Thanks very much for joining us again Wednesday evening for our regular update and town hall. We're joined this evening by Dr. Anil Waithian. Dr. Waithian is the Commissioner of the Department of Behavioral and Community Health in Dutchess County, our health department. He is an infectious disease doctor. Has been leading the Behavioral and Community Health Department and, of course, helping to coordinate our response to the COVID-19 pandemic. Also on the line this evening is Assistant County Executive Ron Hicks. Ron coordinates our Think Dutchess Alliance for Business, our economic development efforts, and in this case has been key to responding to business concerns and the interest of small businesses all across Dutchess County. So we're calling thousands of residents this evening. We're doing our Facebook Live Town Hall along with a telephone live town hall. And as you are on the phone this evening, we're going to try to get to as many of your questions. If you have a question, dial 0. You'll be asked to record that question, and then when we call you, you'll be live. We'll call you back up to be live to ask your questions. Now, we're on Facebook as well, so if you have a question, please add that to the comment section there underneath the live feed, and we'll get to as many questions as we can tonight. So first, let's jump right to our data points, and I want to reference the county's dashboard and some additional information you should be aware of. So as you know, if you go to the county's dashboard today, it has been on hold, if you will. We received a significant amount of data that we needed to get through. In particular, the county is transitioning our active cases from our current contact tracing system to the New York State ComCare system. And that transition has allowed us, but also required us, to go through a lot of our active cases, identify with certainty who is no longer an active case and who is. And so in order to be very transparent with you, rather than giving little bits of that information, we decided, again, as we did several weeks ago, to take the daily count down for the day for several days, and we should be live again tomorrow. Today's Wednesday. We should be live again tomorrow, Thursday. At last count, we had just under 4,000 confirmed COVID-19 related cases and some 1,300 active cases. Now, when we go live again, you are likely to see a reduction again, I'll say significant reduction again in in active cases. And that's because as we complete the tracing process and work with those confirmed cases, we're identifying who's met the basic criteria to no longer be active. And again, we're not saying that you're, in quotes, recovered, because that, although we do identify the recoveries on the dashboard, but remember that recovery designation is really more about meeting a timeline than necessarily truly understanding being recovered from the disease, if you will. But you'll see a significant reduction in active cases come tomorrow when we go live again. And that's all good news because we're seeing a decline in the total number of cases. So again, you're joining us live on Facebook. If you have a question, please type that in the comment section below the live feed. And we are calling thousands of Dutchess County residents. This is County Executive Mark Molinaro. Every other Wednesday evening, we have these telephone town halls. And if you have a question, dial 0 on your phone. You'll be asked to record that question, and then we'll bring you up live, and you can ask that question live on the call. So again, you'll see an update tomorrow on the county's dashboard, specifically as it relates to active cases. You'll see a decline in those active cases, and it will be a significant change as we've gone through and sort of updated those ongoing cases and transitioned from the county's case management system to the shared case management system we are working on with the state of New York. Now, additionally, if you go to our website at dutchessny.gov, you'll see links to the state website, and the state continues to update its tracker, its dashboard, if you will, and you'll see some additional information there. And the good news for us is that particular dashboard, that metric tracer, if you will, or tracker, is very informative. It's very useful in this case, and if you look at the individual metrics that the state is monitoring. It gives us a good way of sort of determining where we are, both with the current cases, if you will, current status, but also allows us to project a little bit forward based on what are those rolling averages that we use in order to make some of these determinations. The state has these metrics. Those metrics are used to measure where we are as a region. Dutchess County falls within the Mid-Hudson region. You can take a look and see a regular steady decline in hospitalizations and severity of the cases. We continue to have good quality access to testing, and we are testing a good number of people. And those numbers continue to come in. The rate of transition has been on a steady decline, which is all very promising and good. And using those metrics, the state has established this phased reopening and reopening of community and business activities, and we fall now in Phase 2. Phase 2 began 2 days ago. But if you go to the dashboard, the state's New York Forward dashboard, again, you can find that through duchessny.gov. You'll see some individual data points that we hope will be very useful to you, but it also for us is very, very useful in monitoring where we are. And you can see the region broken out and sort of the trends in both transmission and hospitalizations. Again, Dutchess County falls in this 7-county Mid-Hudson region, includes Orange, Dutchess, Putnam, Rockland, Westchester, and Sullivan counties. And as you know, every day the leaders from those counties interact with state officials in order both to get clarity on certain issues and also to ask questions and, quite frankly, to argue quite a bit for some of the things that we want to happen locally. Now, as I mentioned, again, the state has taken this incremental phased approach to reopening. The Mid-Hudson region began Phase 2 on Tuesday, and again, that phased approach, you can see if you're watching us on Facebook Live, that slide here talks about what those phases are and what businesses fall within those phases. Again, Phase 1, we already, of course, have met and gone through that first 2-week period. Construction, manufacturing, retail was able to reestablish in some capacity. Wholesale, agriculture, etc. So Phase 2, as you know, is offices. It's those professional office spaces of all kinds. It includes as well hairdressers, salons, barbers, and we were successful. County leaders across the state really fought hard to get outdoor dining moved up earlier in the process. In particular, in this region, our concern was that New Jersey and Connecticut had already begun reopening at a faster pace. And again, that's their decision making, but there were certain safe activities that we felt posed a very low risk of concern, and outdoor dining was one of them. So we were very successful in getting that moved up to Phase 2. So Tuesday began Phase 2, and you'll likely have seen that outdoor dining is one of the components of Phase 2 that we were very happy to achieve. So the governor recently announced, again, as I said, including outdoor dining in Phase 2. We were successful in arguing for that. We were successful in having the state allow and enable in-person special education summer school. Be happy to answer questions about that because we are still struggling to get school districts and providers to reconsider decisions they've made already to provide special education services in person. Houses of worship can and have reopened. The state guidance is 25% of total capacity. So if you have a church that or a house of worship that obviously can house 100 people, 25 of them can come to a service of 25% capacity. And earlier this week, the governor announced a change in high school graduations that isn't enough in our estimation, but does allow for now, as we said, sort of a parking lot version of a graduation. So in car, you can have a car parade or convoy of some kind for graduation and an in-person graduation. And there's some creative ways that I think school districts may want to consider offering those ceremonies. So again, those are some of the announcements that came out earlier this week. We'll jump to a few questions. Let's go to Bob in Poughkeepsie. Bob had a question regarding senior day centers. Bob, go right ahead.
Yeah. When are senior daycare centers going to be opened?
I would, so it's a good question. They will be late in the process, again, mostly because the concern that we have regarding the disease and how it affects older populations. I would not expect those before phase 4, and even in phase 4, which would be middle to late July, you'll likely see reduced capacity and reduced activities at those centers. And it's, again, out of concern for the way the disease obviously has affected seniors. We have Dr. Anil Waidyan with us. Dr. Waidyan, why don't you offer just broadly what we've seen as far as how the disease has affected different populations, age populations? Because, again, some of the questions that we've gotten over the past couple of days have also been about those with developmental disabilities. And simply having an intellectual disability doesn't necessarily make you vulnerable to the disease. What does, though? And I'm going to remind you, you don't talk as loudly as I do. So if you don't mind speaking up a little bit, and we'll have you. For those of you watching on Facebook, Dr. Waidyan's coming to us for video, but otherwise, Anil, go right ahead.
Mark, thank you. So we've learned through this pandemic that, again, different segments of the population are affected differently. And so one of the biggest risk factors is age. And we know that with regard to morbidity and mortality, meaning individuals and how sick they become, or whether they end up with a fatal outcome, varies by age. Individuals over the age of 65 are much more likely to become severely ill and have a fatal outcome. And in fact, when you look at mortality rates, people over the age of 85, if they become symptomatic and ill, the mortality rates range over 10%. So definitely when you look at risk factors, age is one. The others include underlying cardiac disease, underlying lung disease, liver disease, kidney failure, and any disease that lowers one's immune status. And so we look at all these disease states as risk factors, and we want to be able to tell individuals who fall under these risk categories to be especially careful, especially in re-engaging with social activities and group activities that may assist in transmission. So this is one of the reasons why this phased approach of reopening is so important, to make sure that as we re-engage with individuals who may be lower risk, we're not seeing spikes in transmission, so that we're advising individuals who may be older or with other risk factors appropriately. So thank you for that question.
While we're still with you, we're going to get a question from June on Facebook. She asked about the pediatric inflammatory disease that apparently presents itself a little bit like Kawasaki's disease, and whether or not that's contagious. Do you want to talk a little bit about, one, we don't have any cases, or do we? I don't believe we have any cases identified in Dutchess. And secondly, in that case, how does it present itself, and is it in and of itself contagious?
Thank you for that question, Mark. I will tell you that we've had a couple of cases that were suspicious, but to date, we have no cases within Dutchess County. The disease itself, or that syndrome itself, is not something that's infectious. So just because a child may present with those symptomatology does not mean that that child then can transfer to another child. So this disease state is probably very similar to Kawasaki's or toxic shock, where the individual's immune system has, you could say, cytokine release and other substances that cause a host of symptoms, meaning they could get, their eyes may get swollen, they may have cracked lips, they may have strawberry tongue, they may have swelling of an extremity. And so this is all manifestations of the immune system going a little haywire. So I will tell you that, again, with so much transmission going on, especially in the city, we saw several cases, meaning multiple cases. But within Dutchess County, we haven't seen any cases. And to your question with regard to being transmissible, it's not an infectious process. It's a syndrome that comes from other infectious etiologies such as COVID. Thank you.
Thank you, Neil. Adam asked about the Stormville Flea Market. Why do I think that they chose to cancel the Stormville Flea Market this year? Ron Hicks, are you aware of the flea market? I would think that that's not going on this year.
Yeah, it's flea market's actually it's probably based on, if it's in the one in Pleasant Valley, it's based on that North American industry classification.
It's the Stormville.
System.
They're asking about the Stormville Flea Market. Yeah.
Oh, the Stormville one. No, that is a large event. We haven't heard that that's open.
Okay, so events like that would fall into phase 4 of the state guidance, which is the larger social events, larger community activities. As you know, there were several announcements made recently. Most of the county fairs in the state of New York have been canceled for this year, although I know that the Dutchess County Fair, run by the Agricultural Society, is trying to come up. They won't have the traditional fair this year, but they're trying to come up with some activity that kind of gives us at least an opportunity to enjoy the fairgrounds in some capacity. I don't know offhand if the flea market has announced its closure, but its cancellation for this year. But that would be a phase 4 activity, and that hasn't that we haven't been given specific guidances for that as well. Lisa asked about protocols for camps and summer education program. Two separate things. Let's do camps for a minute. So day camps are permitted in the state of New York effective June 29th. Dutchess County had already begun the process of considering and then permitting day camps here in the county. So for day camps, what we've asked is that the camp providers develop precaution plans or safety plans that consider the basic protocols. There is not an expectation, and Neil will correct me if I'm wrong, that all participants wear face coverings at all times. It's not the specific expectation. The expectation is come up with a safety plan that works for you to slow the rate of transmission. We'll consider it. We'll give some ideas if that's necessary, and then we'll permit them. So day camps are permitted as of June 29th. That can occur in the state, and here in Dutchess, we're prepared to have those permitted. I do want to take this opportunity, though. Many camp providers need to make that decision sooner rather than later. So if you're at home and you have the resources, and I know many people don't, but if you're considering a day camp, whether it's at a private business, for instance, like the Renegades have their summer camp, Gold's Gym has their summer camp, or it's a not-for-profit or some sort of traditional camp setting or municipality, please look to those organizations, go to their websites, go to their Facebook pages, find out when they need you to inform them if you're going to participate, because they may need you to sign up now so that they know that they have a certain base number in order to actually open. And again, many municipalities, many families will decide just not to participate, and that's your right too. Remember, just because something's open doesn't necessarily mean you have to take part in it. That is your personal decision, and as it relates to camps, you may choose at the end of the day that you don't want to send your child to a camp. But for those of you who do and have the resources to, please reach out to those providers, those businesses, those camp organizers, and tell them whether or not you're going to participate. They may need you to sign up earlier rather than later. Crazy Andy's Flea Market on Route 44 in Pleasant Valley apparently is decided to open this weekend, and that's likely what Ron Hicks was referring to as related to some questions. Joanne asked if are you suggesting towns open their playgrounds in Phase 2? Insurance companies say not until Phase 4. First, I'll offer to you that whatever anyone tells you is going to happen in a particular phase because they think it may happen in a particular phase doesn't have any new information or more information than any of us does. So keep in mind that just as we assumed graduations wouldn't occur in person until Phase 4, just as we assumed beaches wouldn't open until Phase 4, those things change daily. I will tell you that Dutchess County is saying to municipalities that municipal parks are open. in that it is not logical, nor do we have the resources to close a playground facility in a municipal park. So we have chosen not to fence them off or gate them off. We're simply asking those who go to municipal parks to minimize some of that physical interaction, to be respectful and considerate of others. And I have told municipalities that is our approach, and that they should make those choices based on their decision making. But in most parks, taking a child to a park and then saying, yeah, but you can't play over there, isn't going to be very enforceable. So I will tell you that is our determination. We're committed to that. We want everyone to be safe, but if our municipal parks are open, that includes the assets within them, and we're just asking people to be considerate when they're taking part, when they're using them and taking part in them. So again, if some municipality says that their insurance company doesn't want them to do it yet, that is certainly their right, and it's your right as a citizen to ask that question as well. I can tell you that several have decided to just allow their parks to remain open and are asking for that consideration. Some have decided not to. But again, I would offer to you, if an insurance company is saying, we're certain that's not going to be to phase 4, they don't know that because every day, as you know, those decisions are being made and are likely to change. So that's what we're functioning off of. We're using and applying the same basic state standard for beaches and pools. We're using that same basic expectation in our parks and playgrounds, which is limit that physical interaction to the extent possible and try to be respectful and considerate of others and try to limit the capacity. Just as a reminder, if you have a question, you're on the phone, dial 0. If you dial 0 on the phone, you'll be able to ask a question. Anne from Hopewell had a question regarding nail salons. Anne from Hopewell, if you're there, go right ahead.
Yes, thank you for taking my question.
You're welcome.
I'm interested in finding out during which phase nail salons are able to open.
Nail salons, tattoo parlors, and other personal care businesses can now open in phase 3. Ron Hicks, do you? Phase 3. Ron Hicks, you're on the call. The state issued new guidance for those businesses. Is that right?
Yeah, that is out for the other areas, and we think it's phase 3. Well, we know it's phase 3 right now, but we continue to push to accelerate that. The county executive does that on a regular basis, but right now it's phase 3.
Okay, so phase 3, there are some basic guidances that they'll need to be expected to follow. We are asking that be accelerated a bit. Again, we've questioned the logic of being able to trim one's sideburns but not paint their fingernails. So, but again, phase 3, which for us, the timeline for phase 3 would put us, again, assuming these are all 2 weeks, phase 3 would begin on Tuesday, June the 22nd. And that would be the time that those can open, along with tattoo shops, tattoo parlors. And again, those guidances have been made available, and we'll continue to push the state. Several of you, I know that I don't really obsess about this, but I've asked, on social media, you're not, either, you should do what the governor says or you should fight more. Believe me, our goal here is to try to make decisions based on real data and consistency as it relates to public health risks and public health concerns. Believe me, we fight every day. Every day we have a call with the governor's staff and the state office, state officials, where either we're articulating a concern, advocating for more information, or outright arguing over a particular business type. So we'll continue to represent you and advocate for you as we move forward. Michael had a question regarding Little League, and that's probably a good opportunity to talk a little about athletics and sports activities. Michael, do you have a question?
Morning.
Michael.
Yes, sir.
Go right ahead. What's your question?
My question is just about when they're going to be opening up the fields so we can start kind of giving the kids an outlet. I'm the vice president for Cal Ripken Poughkeepsie.
Yeah, good question. So right now, the parks can be open, but if you're an organized sport, the state has not permitted those activities to occur yet. Only some low they deem as low risk athletics. We believe that would still be in the phase 4 category. Again, Ron, not to put you on the spot, but Ron Hicks. We've been advocating for organized sports, again, acknowledging certain precautions need to be in effect, but you want to talk a little bit about the work we've been doing in particular, baseball has come up just about at every call we've had.
Yeah, that's right. We've actually been working with a couple different groups in the region, actually one in the state, who has put together guidelines that will allow them to safely operate and practice and hold their games. And we continue to push in what is called the control room once every day at 3 p.m. To forward this guidance to the state and say, hey, listen, these guys can do it safely. We're willing to monitor it and make sure that they do it right. So please let them go forward. And that's what we're doing with across industries. But that is right now pending.
Right.
As a low-risk activity.
Right, and the only reason we tell you this, and I understand the question, if you're an organized activity, meaning you're a tax-exempt not-for-profit or a business that's providing those services, remember, the governor's orders under the powers that the state legislature granted the governor have the force of law. So kids can still go out and play. You can still go hang out at a park. Some parks have their ball fields open. That is still all very, very allowable, but if you're an organized activity, the state has not given you that go-ahead yet, and we just don't want to give you the wrong advice, even though at this point we do think that certain sport activities are certainly safe, and certainly safe as they relate or can be compared against some of the other activities that have already been approved by the state. We'll try to go through a couple of questions we've gotten on Facebook. Jennifer asked about bingo. Believe me, I know a lot of folks who want to get to the bingo halls again. That is likely a Phase 4 activity, again, sort of that group setting. In particular, I would suggest, and I don't know, Jennifer, your age, so I won't say anything about you individually, but those kinds of activities tend to have older populations participate, and so that if they're going to have those things, VFW halls, Legion halls, Elks clubs that organize those kinds of activities, they're going to be asked to be considerate of some of those safety precautions for vulnerable populations. Wendy asked about gyms. Can we push for gyms to reopen in Phase 3? Yes, we are pushing for gyms to be open in Phase 3. Currently, as you likely know, they're in Phase 4. We do think that there are safe ways to manage those gyms. We are trying to push for those to be in Phase 4. In the meantime, in Phase 3. In the meantime, we're really aggressively saying there's certain components of gym activity that could very well occur even now, sort of the individual training or even small group trainings outside. So we want that capacity to move forward. If a gym has a pool that is accessible to the exterior, meaning you don't have to go through the gym in order to get to that pool, we are permitting those pools, I think. If it's a pool with exterior access, we are permitting them, correct?
That is correct. And if it's a facility that's already open and that pool is within that facility, yes, we are allowing that also.
I think the pool in Red Hook may have decided they weren't going to open. We are permitting them, and they can open with limited capacity, and so it really becomes a question of whether or not the organization wants to begin that process and sort of move forward. But again, we are permitting pools in Dutchess County based on both the guidance we've received on our internal calls or daily calls with the state officials and the guidance that the state has given for beaches and other of those sort of larger activities. So that's what we're doing there. When can indoor swimming lessons resume? Adam asked. This was a strange question we got on a call yesterday. Ron Hicks, were you on the call with the state officials yesterday about swimming lessons?
Yeah, I couldn't. Unfortunately, I couldn't hear Tom's response on it because I was mobile.
Okay, so the state gave some direction. Our position is if pools can open, swimming lessons can proceed, but we'll get clarification on that. But Anil, do you have any answer on swimming lessons?
Whether they were indoor or out. Yeah, and our position is if you permit the pool, which we're permitting, and there's
things with small groups of children or individuals learning to swim. I don't know what the prohibition would be outright. What are we doing, Anil?
We haven't taken a position on this particular issue, but again, your guidance in terms of if the pool is open, it makes sense that classes can occur in the pool.
I don't think we would object to that in the county, and I don't know that we have clear direction from the state that says no. And so our position is, if it's generally permitted, which is the pool is permitted, and the state hasn't said no, then I think our position is, well, as long as you follow those other protocols, that would be permitted. So if you have a particular pool you're interested in and they want to reach out to us, they can reach out to the health department. We'll try to give them some guidance. But I think that would be our basic expectations as well. You want to go to Jacqueline? Jacqueline had a question on the line regarding spas. Jacqueline?
Hi, thank you. I'm just taking my mask off. I'm at work.
Oh, yeah.
So, yeah, happy to be open halfway today for hair only. I'm just nervous and curious. I don't know if there's any answers yet, but in regards to, I'm an esthetician, so I do facials and skincare personally. So I'm wondering when that's going to be allowed, because the client obviously cannot wear a mask during a facial. So I know massages are included in phase 3, which sort of makes sense to me because, the client can remain wearing a mask throughout the entire service. Whether that's comfortable or not, it's a different story, but they can still do it, which is great. But obviously with the facials, they can't. So I'm just wondering, is that going to be in a phase or
yeah.
You know what I mean?
I do, and so I'll use this as an opportunity just to say again, as I said regarding the playground question, whatever we think we know is going to be the next thing. I can assure you, it is likely to change slightly. So we do know, as you mentioned, the spas and massage therapists and sort of that personal care business, including, by the way, tattoo parlors, are included in phase 3. Again, Ron Hicks, no, we don't have any specific clarification from the state between a massage and a facial, for instance. But I'd have to guess that, that a facial, for instance, may not be one of the things that they might want to permit early on. I don't know that for certain. Do you?
Yeah, that's the first. Actually, it's a great question, and never thought about that particular procedure. So it's something that we will bring up on it. But with almost everything else that we've been pushing, there is that opportunity for both the individual who's receiving the services and those providing it to wear masks and PPE. So in this case, you brought up an issue that I don't think anybody has discussed yet, and we'll be happy to raise that to the state level, though.
Yeah, and
Thank you.
You're very welcome, and we get it. But as you mentioned, phase 3 includes those personal care businesses, and hopefully that'll be another advancement that at least helps to some degree. But we'll get an answer, and we'll be here Friday and Wednesday. So if we can get that answer before then, stay tuned, and we'll get it out to you.
Great. Thank you so much.
Oh, you're very welcome, and keep working, stay strong. We're almost there. So Adrian is on the line. She had a question regarding visitation at the Anderson Center, but generally speaking, I'd love to answer that regarding visitation at homes and facilities with individuals with disabilities. Adrian, are you there?
I am.
Go right ahead. Yes, I can.
Yes. So I'm the parent of a autistic young man at the Anderson Center for Autism, and I understand that there was a pause that the governor had stopped on June 6th, and I know that you have been wonderful in trying to advocate for all of us, and we really appreciate that. But the level of distress for the parents not being able to see our disabled children and is just, and the children's level of distress is beyond, it's cruel. It's cruel, and it is just unjust. It's unreasonable. It is, it's discriminatory. And we're begging you, we need your help. So my question is, I understand there's a plan that's been brought up to OPWDD. I've been told that this plan has gone through 19 iterations. We don't know what's been in the plan. Where are we? And where are we in the phases? And when will the parents be permitted to see our children? Because we should not be linked up with nursing homes, and we should also not be linked up with cases in the city because we're up here where we've done a much better job in handling COVID.
Well, I'll offer. So you have said everything that I've said. Only you may have you may have been nicer than I've said it. So I will say to you, we get it, and I thank you for acknowledging the advocacy we've done so far. But to your questions, there aren't any answers yet, and that actually speaks volumes about where the state has been with making sure that we focus on those with developmental disabilities. Yes, there is a visitation reopening plan that no one knows about that has apparently gone through OPWDD, the Office of the Office of People with Developmental Disabilities. And yet still today we don't know what phase and we don't know those details, and it is criminal, and it is negligent, and it is not appropriate. So what I can tell you is that we've brought it up at every call. I, as you know, have joined many others in demanding the state develop the guidance, and this isn't a question of just we're throwing away safety. The issue is that your child and these individuals are human beings who have not only constitutionally protected rights, but they have human rights that ought to be acknowledged. And the fact that this has not been developed yet suggests that it just isn't a priority to state decision makers. And that is criminal and negligent in and of itself. So we are asking, we are going to continue to fight for this. I am hopeful that those protocols happen soon. I will tell you that we've gone right to the governor and we've gone right to the OPWDD, and we're going to get an answer one way or another. Now, to your point about sort of what else can we do or what should we do, this is my opportunity to say that we also need you to advocate as well. And one of the ways, not just individually you on the call, but all of us, and one of the ways you can do that is to reach out to your state legislator. And I want to be clear, we said this a week ago, now is the time for you to pick up the phone, to visit, go to your computer to email them, go to their social media pages and say to our state representatives that it is no longer acceptable that there is not a set of guidances or protocols for the visitation of our loved ones that with developmental and intellectual disabilities. It isn't. And there are facilities and organizations that know that know the protocols that could be safe in providing visitation. And that this is now got to the point where it is cruel and harmful to the individual, and it's just no longer acceptable. So if you're watching us on Facebook, we've posted that the state lawmakers' information. We ask you, they're all advocates. Believe me, everyone that represents Dutchess County shares this concern, but we need them to make clear to the governor and to the Office of People with Developmental Disabilities that enough waiting, enough taking your time. This isn't something that is that can just be sloughed off, and we cannot continue to sit in this sort of cryogenic freeze. Our loved ones are being compromised because of it, and there's a safe way to provide for that visitation. So we're going to keep fighting for it. I promise you that. And I really ask parents and families and anyone of goodwill, whether you have a loved one with a disability or not, creating that opportunity to have safe visitation now is necessary. Just as an example, OPWDD issued guidances in April and hasn't changed, hasn't reissued, hasn't reformed anything since then. Yet, over the course of the last 2 months, we have had hundreds of guidance changes that have occurred for whole hosts of categories of businesses and individuals. And simply being an individual with a disability does not make you vulnerable to the disease. As Dr. Wythian has mentioned, we all know there are certain underlying ailments that do make you susceptible to this disease, but having an intellectual disability is not one of them. So therefore, we really encourage you to join us and advocate for those reforms. And it is, again, you said it better than I could. It is criminal that we have to fight for this this late in the process. So if you're on the call, you're joining us live. This is County Executive Mark Molinaro. This is our every other Wednesday telephone town hall. We're also live on Facebook. If you have a question on Facebook, add your question to the comment section underneath the live feed. And if you're on the phone, dial 0, and we'll get you in the system to ask a question. And we're going to be doing this until 7 o'clock tonight, so stay with us. Let me go through a few Facebook-related questions. Catherine asked about the Poughkeepsie transfer station. While I don't know if they've decided, I can tell you that the transfer station is deemed essential, so they can open. They are able to function. The question is, can they do that with their staff the way they wish? And we don't yet. It'll be up to the town to make that determination. But they are not deemed unessential or non-essential, and they're not deemed being forced to close. It's just, can they provide that service, limiting the impact to their staff. Jeff asked, when towns go inside home, when can towns go inside? When can towns go inside to do building inspections? They can. In fact, building inspections for construction and for safety purposes are deemed essential, and municipalities have been advised that they need to have the proper PPE, but home inspections are permitted under the guidance. Ron Hicks, did I say that correctly? Home inspections can occur by municipal employees or private home inspectors. That's all. That has actually been appropriate through this process, that they were always deemed essential.
So yes, they have always been essential.
And so if there is a municipality, or Jeff, you're coming into contact with someone who that municipality isn't providing that service, please reach out. We'll be happy to communicate with the supervisor or mayor. We meet with them twice a week on a virtual call or conference call, and be happy to make sure that your concern is directed to the right municipality, but they are permitted. Nancy, when will funeral homes be allowed to have more than 10 people? That at this point is still a state determination. Again, we're of the mindset that if religious services and worship services and faith-based services can be at 25% capacity, well, then certainly ceremonies like a funeral, at least indoors, could be and could function at the same capacity. But as of today, the state has not permitted those larger group services yet. And believe me, I understand how troubling and distressing that is for so many families. But the state has not permitted that in large numbers just yet. We are advocating for sort of a similar expectation. Again, if you can engage in that sort of physical distancing, then limited occupancy or limited capacity seems to be or would be appropriate at this point. Ron Hicks, this question is for you. If a business isn't following protocols, what should one do? It depends. Keep in mind, not all of those protocols are mandated. Some of them are just simply guidances. But if somebody has a question regarding the enforcement of these guidances or instructions, Ron Hicks, where do they go to register their concern?
You can go on. You can Google, but you can go on the state's website under New York Forward to file a complaint. But it depends on whether you are an employee that is concerned about the environment, or if you are a customer or the general public. If you're an employee, there is actually a place on the New York State Department of Labor website where you can file a COVID-related complaint. But if you're a general public or a customer and you want to report the noncompliance, you can go on the website. Actually, if you go on duchessny.gov, you can get to the New York State website through that to file the complaint if you need to.
Right, and I want to offer this, again, I think it really speaks to who we are as a community. Listen, we're at a point now where things are reopening, the guidances are changing daily, and what we know about the disease, well, we're learning something new about the disease every day. My suggestion to residents is to be considerate of one another, meaning that if you feel like someone isn't following the guidance that you think is the guidance, well, then I'd offer to you that there's always a way to simply ask, right? So being a good neighbor first is the right approach. So if you go to a park and you see a sign and it asks for social distancing, don't tear the sign down. One, it's not your sign, and two, it is a recommendation that people are making in order to be safe. If you go out in public and you see somebody wearing a mask, don't confront that person because you don't think that you need to wear a mask. That person made that choice because they felt it was right to be safe, and we're asking people to wear face coverings when it is possible. And if you see somebody out that's not wearing a face covering, please don't shame them. They made that decision, and your choice is, to the extent you can, to be physically distanced from them. I understand that every day there's going to be no guidance. It makes things less and less clear. And in the same respect, I understand that we all have our different views of both how to react or respond to this disease and what we should be doing next. try our best to follow the protocols, try our best to follow the guidances, but most notably, be considerate of one another. I don't think that we should devolve into shaming or judging or attacking one another. And I also would say to you, reaching out to say to somebody, I think you should follow this or follow that is appropriate. Asking, or sort of ratting out or tattling on one another, that's your call. I just think it is always best to be considerate, to be upfront, and to try to listen to the different opinions that other people have. So that's my guidance at the moment. To the extent I think it's I think it's the way we ought to be functioning. I don't think we want to devolve into anger. Dr. Wythian, we did get a message on Facebook. Devinder said or referenced, I know online you can read a lot of studies. So online there's a study. If you start with I read on Facebook, you know that you should be a little bit hesitant. But on Facebook, there are those who point to studies about those with a particular blood type being less likely to contract COVID-19. Can you clear that one up for us?
Again, I have not read the study, but indeed, I've seen the headlines that, again, those with type A blood are at particularly higher risk, and those that are not within that blood type are at lower risk. So again, I before making any statement, I would like to look at the study, but this is a headline that I've also seen.
Is the general acceptance. Is that fair to suggest?
Correct. They're not trumpeting this as a breakthrough. So again, it's something that I'd like to explore, but I don't think it's going to have a radical change in how we approach and prepare and take precautions.
Fair enough. Moira Lynn asked about special education schools handling masks and social distancing, keeping in mind that, again, some of these services are critical, and obviously many young people with a particular disability may just not be able to or comfortable with or physically able to focus with a face covering. So what the expectation is that schools develop the strategy appropriate to them, understanding that again, special education is delivered principally through a sort of almost an adversarial process, right? We have to go to our committees on special education. Teachers and providers make the case that certain services are appropriate, and then families or students get to express what they think is or is not appropriate from that point. So we believe that in-school special education services can be provided safely. We believe in certain circumstances, again, in many school districts, this is a small number of students in a group setting where a social or physical distancing could be achieved. In some cases, it may actually be just the therapist, occupational therapist, speech therapist, physical therapist interacting with a single student, in which case we would encourage, right, the therapists themselves to be wearing a face covering, but perhaps as long as the student isn't immediately on top of that person, that the student could certainly function without one. Again, what we're saying to districts and what the governor's executive order offers is that you develop a plan and then you implement it. And I do want to say this. Many providers and school districts have said, well, we already decided, so therefore we're not reconsidering. I would ask you to reconsider. Over these last 100 days, we have all made decisions based on the facts of the moment, and then had to change those decisions because new facts are presented. Simply because you made that choice already does not mean that you aren't obligated to reconsider it. You are obligated to reconsider it and to provide under the law the best and highest degree of service in education for those that need it. And therefore, the state constitution and state and federal law suggests that at the very least, you provide the best quality educational service in the area of special education possible. It is now possible under the governor's order to provide that in person, and you really ought to consider that. And if ultimately you decide you can't, that should be a decision that you conclude having reevaluated the facts on the ground. And the facts on the ground changed 2 days ago. And so we're asking people to be considerate of that, to be earnest about it, and to be deliberate about it. Just as today the rules and guidance has changed on a whole host of things, and tomorrow they're likely to change again. And that has been the reality these last 100 days. Sandra is on the line. Sandra had a question regarding town halls and state offices, government offices. Sandra, if you are there, go ahead and ask your question. Sandra, are you with us? Sandra, if you're with us, go ahead and ask your question. Sandra? Okay. So Sandra had a question regarding town halls. Let me offer you that municipalities can begin the process of opening their government facilities. They all will have certain protocols and precautions. In Dutchess County, you'll start to see the physical offices reopening, in which case, with that, on June the 15th, you'll see some of those spaces reopening. And we'll be doing certain services by appointment here in Dutchess County. Municipalities may do the same thing. They may prefer to do drop-off or by appointments only. You should check with your town, village, or city government, but they are all currently now in the process of restaffing with the expectation that on or about June 15th, some of those functions begin to reopen to public access. Regina, can I bring a cleaning service into my home? Ron, cleaning services are maintenance, right? That is general, that's essential in part and approved, correct?
That's our understanding, yes.
So a cleaning service can come into your home if they wish and if you wish. There are protocols, and remember, every business should have its own safety plan. And if you want to see that safety plan as a consumer, you're allowed to ask the business, well, what is your safety plan, and can I know it? And then you can make the decision as to whether or not you want them in your home or not. My mother ran a small cleaning company for a number of years, and I can tell you that if she's watching, Donna, my mother, probably would never have caught the disease because she was, always covered in Clorox and cleaning supplies. So, nevertheless, that's a decision you get to make, but it is essential and deemed appropriate at this point. And remember, I'm using those terms. I don't like the term essential, non-essential. I think every job, frankly, is essential, and everybody needs to be able to go to work. So, Sandra, are you there? Well, jump to you and your question.
Hello, yes.
You're with us. Go ahead, Sandra.
Okay, I was the one who asked the questions about our local town hall. I live in LaGrange.
Yes.
And I just wanted to know when will they be opening up, but I think you just answered that question.
I did, and so you should, though, reach out to the town LaGrange and make sure that you know their schedule, but they are beginning that process. All municipalities are beginning that process, and as I said, I think by and around June 15th, you'll start to see them all open up a little bit more. But keep in mind, many of them will have appointment only, so you want to be able to address that. So we have had a lot of questions regarding the Department of Motor Vehicles. I can tell you the county clerk, Brad Kendall in Dutchess County, who administers the DMV. DMV is a state office, and the state establishes those guidances. Brad Kendall, who I think is watching the Facebook Live, so I'm not supposed to say anything I shouldn't say. But what I would tell you, for those of you who have questions regarding the Department of Motor Vehicles, tomorrow, check for updates. So tomorrow afternoon, we hope to have new guidance finally from and for the DMV. You can call 486-2384. When we go live again on Friday, we'll have that number up on the slide so you have it. But again, 486-2384, the Department of Motor Vehicles, and visit the DutchessNY.gov website tomorrow afternoon for updated information. There will finally, we hope, be new guidance from the state for DMVs, and Brad Kendall will get us updated on that. But as of this moment, I have no news to make, but tomorrow afternoon that should be updated for everyone if you're interested in DMV services. Whew, got that one covered. How's that? Mario is on the line. Mario had several questions for Dr. Wythian regarding a whole host of things. Mario, do you want to ask your question?
Hello?
Yes, Mario.
Yes, thank you for taking my call. Can we get hydrochloroquine if prescribed by a doctor, and also for testing? Is it a prescription required to get the testing, or is it optional on our part if we think we need to have one? And what about testing for if we have developed immunity? Thank you for taking my call.
You're welcome. Grazie. So Dr. Wythian will talk a little bit about the medication, the prescription, but let me offer to you on testing. There are certain locations that require a prescription and certain locations that do not. So if you visit duchessny.gov, go to the COVID-19 tab on the website, you'll have a testing and collections tab that'll give you that information. The bigger public sites, for instance, Duchess Stadium, that site location run by Nuvance, does require a prescription. Mid-Hudson Regional does require a prescription. Pulse MD, I don't think does, and then Rite Aid and some of the pharmacies, no prescription. So it really depends on the location. And if you have a physician, call your physician. They may be able to administer the test for you at their location. Several of them do. If you don't have a physician to get a prescription, you can reach out to us, the Department of Behavioral and Community Health, based on basic protocols, can issue that prescription for you. Dr. Wythian, do you want to answer the other two questions regarding antibody testing and hydrochloroquine?
Sure. Thank you, Mark, for taking the first part of the question. That was a mouthful. With regard to antibody testing, what is quite difficult is what that antibody testing means. What I could tell you is that there is probably over 100 antibody tests that's available. Those tests, unfortunately, have not been validated on a large population set. And so we do not know, number one, how they behave. The other thing that we don't know is if you develop antibodies and the test identifies as that you have antibodies, the one thing that we can say for sure is probably sometime in the past, you had the disease. That's all that we could really extrapolate at this point. We cannot extrapolate anything about immunity, whether it's protective, how long it's protective, whether you will not get sick in the future. That's the current state of events as it relates to antibody testing. With regard to hydroxychloroquine, a physician can prescribe that medication as he or she sees fit. So I think with regard to any other body coming in between the doctor-patient relationship, they won't do that. So if your physician feels it's necessary, they can prescribe it. But with regard to hydroxychloroquine for COVID, the evidence that we have with the numerous studies that have been done with regard to prevention and in people who are sick, the evidence does not point to a benefit. And so as it stands now, outside of very, very discrete studies and clinical trials, it is not recommended with regard to COVID-19.
Thank you, Neil. Let's try to run through a few more of these questions. We also tonight wanted to give you a brief update on budget conditions and some of the impacts on county government. But before we do that, Francis asked, when will the sheriff's office be able to process permits like gun permits? The sheriff's office is processing gun permits, so you should go through that process. The sheriff's office, Dutchess County Sheriff's Office, is still conducting those processes, and then anything beyond that, check with the civil division at the sheriff's office. They have been fully functional, and I want to take this opportunity to thank Sheriff Butch Anderson, Under Sheriff Kirk Imperati, and all the men and women of the Dutchess County Sheriff's Office. I will tell you, for all of those in law enforcement, this certainly has been a very challenging time. I can offer to you, in the many conversations I've had with the undersheriff and representatives from law enforcement and the ones and those in the sheriff's office, they all recognize not only, by the way, specifically what occurred in Minneapolis is nothing like the kind of policing that they train for and are prepared to do in this county, and they were horrified by the murder of George Floyd in Minneapolis. And what I'd offer to you is that we've been very fortunate that Sheriff Anderson has always said to his deputies, treat others the way you would like to be treated. And over the course of these last 2 weeks, as we've watched protests and we've seen the horror of that murder on television, they've conducted a lot of self, sort of reflection, and I mean that very sincerely. They reviewed their policies. They're looking at the way in which they make decisions, and I can tell you, as an accredited institution, a federally accredited institution, the Dutchess County Sheriff's Office has already and reaffirmed its commitment to continuum of force training. They have banned the kind of chokeholds and the choking, that kind of behavior for years. Our sheriff's office has implemented those prohibitions. You'll see, in fact, this county, very gratefully, police officers in Dutchess County have all been a part of our crisis intervention, our de-escalation, and our mental health first aid. And frankly, I just wanted to take that opportunity because, again, what the sheriff and the sheriff's office has been engaged in particular these last couple of weeks, has been, I think what everybody needs to be doing, which is sort of reflect on how we make decisions, reflect on who we are, and really reaffirm that we want to put the best foot forward, that we want to be very sensitive to the challenges that so many in our community have and face, and the reality of racism that exists. And I really commend the Sheriff's Office and Sheriff Anderson for taking that sort of that approach, which is, again, to reaffirm, treat others the way you want to be treated, and to look internally on being sure that we're doing the things necessary to be safe, to be just, and to ensure that we're treating everyone fairly. And I'm grateful to the Sheriff's Office for that commitment and their willingness to again continue. So to your question specifically, they are going through that process. Those processes, they are permitting, and you should reach out to the Sheriff's Office if you have a specific question. I want to get through as many of these as I can regarding the dashboard. We had some questions, but let's do this. Paul asked about contact tracing. Is it working? Yes, but we've seen a steady decline in the total number of cases and the total number of active cases. So, in fact, we are making good progress in identifying positive confirmed cases, and then from there, making those initial contacts with individuals who may have come into close contact with somebody who tested positive to slow that rate of transmission. As you know, last Friday, Mayor Rob Rollinson and I did volunteer to take a COVID test. Dr. Wythian was very happy to stick the swab up my nostril. In fact, he wanted to be sure he got it right. He went into both of my nostrils. That's how pleasant the experience was. We both tested negative, so no COVID-19. Happy to. Rob Rollinson said I could report that. I can't report on anyone else's healthcare conditions, but Mayor Rob Rollinson and I both tested negative, and that is good news for everyone, including us. The contact tracing continues, and we are moving forward with. We are able to keep up with our cases. Dr. Wythian, Karen asked about how accurate the COVID swab tests are. How accurate are the diagnostic testing, both the ones we're using now, sort of this standard, and then that rapid test that some are using? What's our determination on efficacy of those tests?
So again, testing is variable depending on how it's done. You mentioned I stuck the swab in both nose. If it's not a good sample, the testing can be off. So a negative test, even in the face of symptoms, is possible depending how sampling is done. But because the diagnostic testing is a genetic testing, meaning it looks for certain parts of the genetic sequence of the COVID virus, when you get a positive test, you could believe that to be a true positive. But sometimes, depending on sampling, a negative test may be a false negative. So for the most part, a positive test is very reliable. If it's done consistently and reliably, you will get a reliable result. With regard to rapid testing, again, there are some operational issues with regard to whether the reagents and the sequence that they're looking for, the genetic sequence is, if it's consistent and very specific, but typically the diagnostic testing is a good test.
Deborah is on the line. Deborah had a question regarding the dashboard and some outdoor dining questions. Deborah, if you're with us, go right ahead and ask that question. Deborah, are you there? We may have lost Deborah. Deborah was asking about the dashboard numbers. As I mentioned before, we get this influx of data that comes in from time to time. We could just simply leave the dashboard up there unchanged day to day when these things happen. But what we've decided to do, this happened once before. We decided to take the dashboard down for a period of time, cull through that data, get it active, get it validated, get it updated, and then present it back to you in a very accurate and transparent way. Judy had a question regarding the needing address confirmation. Judy, are you there?
Yes, I am.
Oh, good. I've been waiting for you. Go ahead.
My question is on the dashboard. It shows pending cases waiting for addresses.
Yes.
And that number keeps going up instead of down.
Fair enough.
How come?
Anil, do you want to talk to that, or I can jump? I can clear it up a little bit too. But the pending cases on the dashboard speaks to address pending, and it is likely to go up in part because many of the cases are not cases that necessarily Dutchess County has the clear information about. What would fall in that category, Anil?
So, Mark, you touched on some of the issues. Whenever a diagnostic test is done, if it's a reportable, it goes to the state electronic platform. But sometimes the information that goes is incomplete. If we don't have an address, if we don't have contact information, you may have a case that we have no methodology to track or confirm by direct contact with that individual. And that's what skews the numbers a little bit.
And we have in some cases positive cases that come to us from a state institution, prisons in the county, and we actually have a good number of state prisons in the county. And even those that might come to us from other institutions take some time to clarify. Is that about right too?
That is correct. But there is a methodology where we could scrub the data and get them off that list.
So part of why you see, if you go to the dashboard today, why you see it not activated is because we are going through that process, in particular on active cases. Remember, there's not a defined recovery. There is a protocol that determines that you are, in quotes, recovered and can go back to sort of normal living. And so every so often, we want to make sure that information is as up to date as possible. And therefore, as I said, we could leave it frozen there for a day or two, but the decision for us is to take it down, get it updated, and present it again to you. And I know for some people that's a bit distressing, but I think it's better for us to do that than to give you to have it live every day with no change in certain categories. That would be a little bit dishonest, and therefore this is the way we choose to approach it, which is to take it down for a day or two and then represent it with updated information. And you will see when we go live again, you'll see a significant decline in active cases, and that again because as we transitioned the contact tracing and the contact and the case management system, we're able to and almost required now to get through it much quicker to identify all those cases that are no longer active, and you'll see them removed from the active list. And that, I think, is something. One, is positive, which is there are fewer active cases, and two, it's to provide the greatest degree of transparency. So a couple things we wanted to reference. I just want to catch you up. You may have read recently Dutchess County and did present to our workforce a furlough program. This allowed and is allowing a good number of county employees to temporarily sever their employment under this furlough process. It does mean that Dutchess County will pay their health insurance, but these employees will go off the payroll and then move to state and federally subsidized unemployment. So that was one of the steps that we took as a county government to address what is a significant impact to the county's budget. So what I do want you to know is what we are facing over the course of the COVID experience in this pandemic. We have seen a significant decline in sales tax receipts, as you can imagine, and for us, plus a significant delay and decrease in state aid to county governments, we are projecting a significant budget gap, a current operating gap. So what you should know is that 41% of Dutchess County's revenue comes from sales tax. Sales tax represents 41% of the Dutchess County's budget, and that sales tax, we've seen these last three payments, the receipts of those sales tax, receiving of that sales tax receipts, has been significantly reduced. Now, we're estimating as much as a $50 million loss in sales tax receipts, and that's a substantial hit to the county operating budget. New York State provides about 16% of our total budget through state aid, and we are expecting as much as a 20% reduction in state aid. So that could result in as much as a $20 million loss in state aid. So when you total those things, currently we're projecting in our current budget, the 2020 budget, anywhere between a $20 to $80 million budget gap. Now, we took some very aggressive steps, including this voluntary furlough program, a hiring freeze. We froze non-essential spending, and we also have restricted a whole host of capital projects in order to constrict county government. I will tell you that 66 county employees took part in the voluntary furlough program, including staff from my office. We are focused now on getting the federal government to provide aid, and I know that sometimes this doesn't necessarily make the same connection, but county governments need the federal government to assist us. We are looking at significant losses in revenue. We are making significant cuts, and we're going to have to, but we cannot provide the basic services you expect from us without some assistance from the federal government. Now, the House of Representatives adopted the HEROES Act, which is an extensive package that includes a large amount of aid to county governments. No one expects that that's going to become law. However, it is a sort of a negotiating position from the House. We continue to advocate on behalf of counties across this country. 1,900 public health departments are administered by county governments across the country. 1,000 hospitals administered by county governments across this country. The Senate Republicans, the majority in the Senate, have also proposed a series of bills that would provide direct aid to counties. They are going to negotiate. So we're asking for you to join us in advocating for that aid. We are going to need it in order to provide core county services and weather this storm. And those services, remember, 70% of Dutchess County's budget is mandated by Albany. 70% of what we do is dictated by Albany. The remaining third, the 30% that the state considers non-mandatory, almost optional, are things like 911 services, sheriff's department, road patrols, parks and playgrounds, snow plowing, the things that you consider us, sort of expect us to provide. Those are the optional things under state law. So we are going to need that help. But as we move further along in this process, a couple of the town hall meetings we have, I'd like to focus very directly on county finances. I will tell you this. We came into this crisis having among the lowest per capita tax levies in New York State, among the lowest per capita tax rates of county governments in the state, and among the smallest per capita workforces, county workforce in the state. We also, as you know, built up over the last 8 years a reasonable reserve account, but keep in mind that's sort of a one-time thing. You can use it once, and then in order to operate forward, you're going to need to recapture those dollars. So it is allowing us to function with the loss of that revenue, but we still are going to need to get some assistance from the federal government in order to withstand the impact. But you should know that. We'll keep you updated. I'm going to continue to communicate that with you. If you have a question and you're on Facebook, type it out in the comment section below the live stream. If you're online, if you're on the telephone, dial 0. Kevin is on the line. Kevin had a question regarding masks, wearing a face covering. Kevin, are you there? Kevin, if you're with us, you can feel free to ask your question. Kevin? We might have lost Kevin. Kevin had a question. If you have a face mask on, a covering on, can you be closer than 6 feet? Here's the deal. Nothing beats physical distancing, right, Dr. Wythian? Nothing beats physical distancing.
That is correct, Mark.
If you can't engage in that physical distancing, the face covering helps. It is not impenetrable. It is a safety precaution that you can use to slow the ability of the disease to get from your mouth, your nose, out into the air. Do you want to talk a little bit about the benefits, Dr. Wythian, of a face covering? Acknowledging, by the way, as I said before, the guidance and the expectation, the understanding has changed over these 100 days.
Mark, the measures we put in place early in this pandemic has borne fruit, and the metrics that we're seeing that has aided our restarting New York State and our local government and activities bear that out. So now that we are restarting, obviously there's going to be more opportunities for people to have more closer contact. So if we're not able to maintain that social distancing as we restart, it's important that we use alternative measures. And one of those measures is a face covering. And looking at scientific studies, if someone is sick and wearing a face covering, the distance that virus can circulate is a lot less than the 6 to 10 feet that if they weren't wearing face covering, it could travel. So indeed, it's not perfect. It's not, it's 100% type of protection, but definitely if we cannot maintain social distancing, a face covering is very effective.
Thank you for that, Anil. We're going to jump to Kathy. Kathy from Beacon is on the telephone, we hope. Kathy, if you're there, ask your question. Kathy, are you with us?
Yes, hello?
Hello. Go ahead, ask your question.
Hi, Mark. I don't really have a question. I have a comment.
Okay.
My comment is about all the services that are being provided in the area, in the county, in my local city. I just want to express my gratitude because I am so moved by the generosity of people coming together and really helping people like me. I was affected by COVID really bad, and I was hospitalized. As a matter of fact, I was in the same hospital as your dad.
Oh, goodness.
He was hospitalized at the same time I was. Found out about his passing when I came out, and I'm very sorry about that.
Thank you for saying that.
I'm moved to tears because I'm just really so grateful for all the people that have put so much effort into helping people in our county. It's been so impressive and so touching and so helpful, because I really felt alone for a while until I found out that there were people putting things together in place for us, helping me with anything I needed, including getting a pulse oximeter, which was very hard to find.
I'm sure.
Kathy,
yeah. you were never alone. You were never alone.
I felt I was, but then I realized I wasn't. And let me tell you, I think about it, and I am moved to tears, as you can hear, but I just want to say thank you to the community, the entire community, for coming together and pulling us through this and helping us. You know, I'm sure there's still people out there suffering, but I hope they know they're not alone. And if anyone is feeling alone, you're not alone. There's services out there, and you know, if you need help finding them, I'm willing to do whatever I can to get the message out.
You're an angel, Kathy. I can't.
You're an angel.
Well, thank you.
I'm sure all this is because of your leadership, Mr. Molinaro, and a lot of people, including Ms. Pagano and the mayor, the local mayor of Beacon.
Yeah.
Everyone. I'm sure there's a huge effort. I'm not thinking, you know, dozens. I'm thinking hundreds of people throughout the community, you know, that are just doing so much for others right now, and I don't think they're getting the recognition they deserve.
Well, I think that
Beacon Mutual Aid, a lot of them, I'm just so impressed and so touched and so moved by these people. And not only do they help me, they reach out to me, they call me for my mental health needs, my physical needs, any need I could possibly imagine. They are there. They are very helpful, and I appreciate it, really.
Well, I could not say it any better than you. I'm very thankful that you are well, that you're healthy, that you're home. You said it better, but I will just reinforce that there are thousands upon thousands of people who, over the course of these last 100 days, have tried to be helpful, who have volunteered, who have reached out, and I don't take any credit for it. This is a very special place. And I really, truly have been so moved and gratified by the amount of the outpouring of volunteerism and support. And no matter how difficult the struggle has been for businesses or for individuals who may be home without a paycheck, you still have found a way to volunteer. And Kathy said it best, and I am so I'm thankful that you mentioned my father. It was and still is a heartbreak for us, but you were never alone. And neither was he. None of us is ever alone. And so that's it. I can't say anything else. Thank you, Kathy, for that. And it is a good opportunity to say thank you to all of our responders, whether they're working in our public health departments, from the epidemiologists to the contact tracers, whether they're in Office for the Aging or they're in a fire company and a police department. You are all have all been heroic in your service these last 100 days. There is still more to be done, but yet everyone, whether again a career or volunteer emergency responder, someone in law enforcement, someone in public health, or in any one of our hospitals, nurses, doctors, and staff, you've summoned the courage, you've summoned the energy, and you've summoned the capacity to keep up and to keep contributing. And for that, we are all exceptionally grateful. We have a couple more minutes. I'll jump through as many questions as I can. Next time we have a caller that's going to cry or make us cry, we should probably warn you. But thank Kathy. If you need anything from us, you reach out to us. Believe me, you reach out to us. Jackie asked about an extended school year for special needs students. School districts can provide special education services through the summer months, and we're asking you to consider to do that, and that is permissible and possible and allowable. And I do think providers ought to reconsider decisions that they may have made already, at least just to be sure that you're providing the best you can under the circumstances. Kids, students, families need that help. Nate asked where people can find PPE, disinfectants, etc. to purchase. So average residents, I would offer to you, if you're just, certainly our local retailers are providing those services. Ron Hicks, are you still on the call? And if you are, if you're a business owner or someone who needs to provide that to their employees, where would a business turn to access PPE and other disinfecting products?
We have a link on the Dutchess Business Notification Network that has a spreadsheet. You can go to DutchessBNN.com and you can scroll through and you'll see the link that has the list of businesses that are both manufacturers as well as those that are brokering PPE for the public and businesses.
Thank you, Ron. Also, a question about schools in September. I mean, our guesstimate is that there will be protocols in place for schools come September. The goal, of course, and the hope is that schools can return again, assuming the transmission of the disease, the rate of transmission stays low, the severity of cases stay low. We have to get kids back into classrooms. We have to have that interaction with school teachers. Nothing replaces that. And so we expect that there will be school in September. But again, these are decisions that will get made over the course of the next several weeks. When can early intervention services resume? Technically speaking, early intervention services can resume. They can, in fact, and they always were deemed essential. The question is, were providers able to do it? Were families wanting them in their homes? And was the state paying for them? So you have to deal directly with your provider. We continue to encourage and advocate for those services to occur. Dr. Wythe, I'm going to end. The last question I think we're going to take, I'm going to end with you. And it's not to put you on the spot, but we've had several questions about, when do you think we'll have to, when can we choose, basically, or we could always choose, when would we stop giving the guidance about wearing a face covering? What's the thing that we need to be aware of that a face covering might be no longer encouraged?
That's a good question. I wish I had a good answer. I think it's going to be totally dependent on the arc of this pandemic. We're going to rely on whether over time our rates of cases continue to stay low. If we see that during winter months and we're not seeing a second wave, I'm pretty certain that, again, the guidance may change. But if there's any indication in the metrics that we're following that we're seeing a resurgence or a recrudescence of this virus, then, this may be a little longer than expected.
Fair enough. And so
that we will be live again on Facebook only, on Facebook this Friday, June 12th at 1 p.m. We're actually going to come to you live from Duchess Stadium. We're going to talk a little bit about some activities we hope to have in place for Independence Day, and a reminder about our senior picnics this coming summer. And so June 12th, 1 p.m., and our next Facebook Live and telephone town hall is June 24th at 5:30 p.m. Thanks for joining us on the phone. We're going to cut out on the telephone. Thank you. We'll see you in a week or 2 weeks. And if you're following us on Facebook, you can follow us again on Friday, June 12th, 1 p.m. We'll come to you live from Duchess Stadium. Thank you. In the meantime, be safe, stay well, and let's try to be kind to each other.